This week is National Pet Week, and if you own a pet, then you know how important it is to keep an eye on their health.
That's right. So joining us now, we have Dr. Rena Carlson from Alpine Animal Hospital. You brought some friends with you, Kathy and XL. We want to welcome you all. Diabetes is not something, I think of diabetes as being a human disease, having to do with eating too much sugar or having a problem processing sugar. Is it the same thing? I didn't know animals could even get diabetes.
Yes, actually it's very similar. It comes from the pancreas, and the pancreas just is not producing enough insulin. Or the insulin is maybe there but is not able to attach to the cells and do what it needs to do.
Is it related to diet at all? Like, are they getting too many carbohydrates? I mean, like, what causes it?
Well, it can be. I mean, I think it's multifactorial. We can't really say, pin it on one thing, and I think genetics has a lot to do with it. Certainly diet, exercise, a lot of the same factors as we deal with.
So, Kathy, this is your pup XL. About how old is he, and how did you find out that he has diabetes, and what's the treatment?
XL is almost 10, and the main things, there were a couple of symptoms that really triggered and helped me realize that something was wrong. And a couple of the main ones were he dropped about 10 pounds. He was drinking continually. I honestly thought that the fountain I have for him was broken, and I bought a new fountain, and that wasn't the case, because honestly he was drinking so much that there was water everywhere. And the other real thing was frequent urination. He wanted outside constantly, probably 4, 5, 6, 7 times in the middle of the night. He would wake me up to go out and go potty.
Those sound like the same symptoms that you see in humans as well. So you're looking for a very similar disease.
Absolutely, absolutely. And of course treatment then, we've got to provide that insulin. And dogs do not do well on some of the oral hypoglycemic agents that can be used in people. So we go straight to insulin, and he's been on insulin how long now?
About a year and a half.
Year and a half, so.
Do you see things being reversed as far as like the consuming of all the water? Do you see that reverse the symptoms, or?
Absolutely.
Okay, that's
He's
good.
come a long ways.
and maybe have a little bit of chipper attitude as well.
When his attitude really never changed. You would never have known from how he acts. He acts like he's a 2-year-old pup still. But probably the hardest thing for me right now, well, 2 things. He is going blind from the diabetes. And the other thing that's really hard is it's really strapped me as far as the schedule goes. He is insulin dependent, so he does get 4 shots a day.
Oh, wow.
And so I do go home every single day at lunch, and I have to be home every single morning and night between 6 and 7 at night.
So XL is a major part of your family.
He is my lifeline.
So you're willing to put in that time and that effort and to keep him healthy. Let's talk, it's National Pet Week. Let's talk a little bit about pets. I mean, you see people with all kinds of different pets come to their homes. What do pets bring to people's lives?
Well, so much. I mean, just studies are showing people that have pets go to the doctor fewer numbers. There's fewer doctor visits, lower blood pressure. They need fewer medications, and that's for a number of reasons. I mean, they encourage us to get out and move and exercise. They are there when you get home, and they're usually pretty happy to see you, even if you're cranky. They are happy.
Cat. And then they look at you and walk into the other room.
I acknowledge your presence. I'm moving to the foyer.
Well, and XL has taught us so much just about, treating diabetes. And, Kathy and I have worked together and being able to, watch his blood sugar.
They also help with communication skills, because I mean, how many people talk to their pets? Of course, how many people talk to their pets like a baby? But I mean, it encourages communication.
Yeah, if you didn't have a pet, you wouldn't have anything to put on Facebook. Like, you would have no content.
I'd be very bare. It would just no rogue up there all the time.
True.
Thank
well,
you
Kathy,
so much.
Dr. Rena, thank you so much. XL, thanks for coming on the show, buddy. He's about ready to go to sleep.
That's right.